The MAIA trial was a large randomized phase 3 study that compared dara-len-dex to len-dex in transplant-ineligible patients. It was originally reported at ASH in 2018 and subsequently published in 2019, leading to the approval of dara-len-dex for this patient population. After a further follow-up, 36.4 months, DRD was shown to maintain the original PFS benefit that was published in the paper. And at ASH this year, almost after a 4-year follow-up, there was another update presented by my colleague, Dr. Shaji Kumar. And the key things within the results were the median duration of study treatment in the DRD arm was about 43 months compared to 22.6 months with the RD arm. Of the patients receiving RD, there were 75% of the patients who had to discontinue treatment, whereas for DRD, it was 48.4%. And then, within the discontinuation therapies, 89 patients in the DRD group discontinued len, but continued on dara due to side effects. 85 patients on the DRD and 113 patients with RD had to discontinue study treatment due to progressive disease. One of the key things that despite these changes, at almost 4 years of follow-up, there was no change, the median PFS for DRD was not reached, whereas it was 34.4 months for RD. And the PFS curves continue to separate over time with each year of follow-up. So it would be very interesting to see what the eventual PFS ends up being. And then looking at different subgroups of high-risk cytogenetics, specifically the median PFS in the DRD arm was 45.3 months compared to 29.6 months for RD. So quite encouraging results. It didn't appear as if there were any new safety long-term signals observed. MRD negativity rates were also high. And then, the overall response with continued therapy, patients continue to move from VGPR to CR, CR to stringent CR in the DRD arm.